we're not really conditioned to really embrace going and getting that kind of help, medical diagnosis, and just even let alone talking about it. So I had those symptoms for at least 6 to 8 months before I actually told my parents.
Wow.
And I was kind of forced to tell them because I was starting, I was actually going to a football recruiting event where college football recruits were going to be there. So I was doing like a combine style thing. So they weighed me and, did all these other things. And when I used the restroom there, I thought maybe it's just because I was nervous and I saw a lot more blood at that moment.
Coming in, flex. I just wanna win, LA BB, who we running with, 2 2 3 3, I'm on 10 again. State your name.
Welcome to Coming In Hot, Health Opinions and Truths, where we talk about the challenges that are facing our community. Today is probably one of my most favorite episodes that we're gonna do because it's about people who are now labeled patient. I'm gonna pass the mic to my first guest. Please introduce yourself.
Hey, thanks for having me, Melanie. My name is Joshua Denton. I'm 37-year-old patient advocate, and my experiences and desires have kind of derived from when I was officially diagnosed with ulcerative colitis back in 2007.
My name is Dominique Daniels. I am a patient advocate. I am a mom. I am a businesswoman. I am a ulcerative colitis patient and recently diagnosed with Crohn's.
And I'm your host, Melody Noreen Blackwell. President and founder of Color of Crohn's and Chronic Illness. And I too am a Crohn's patient diagnosed in 2018. So this is so near and dear to me because you all are part of my community, right? That's how we know each other.
Yes.
And we have heard all too often, Dominique, of the initial diagnosis of ulcerative colitis, then being now later diagnosed with Crohn's disease. We hear that so frequently in our community. But I have to really start this discussion today with one of the most important questions that you're ever going to be presented with. You ready? Mm-hmm. Is ginger ale medicine? I mean, is it medicine?
So when we grew up, it was. It definitely was. If you had a stomach ache, it was what you got. If you felt like you were sick, that was what you got, was ginger ale.
Yeah, right?
Yes.
Out of fear of possibly having my black card revoked, I'm gonna say that it is medicine to some.
Okay.
It has never been medicine to me.
Okay. Oh.
Okay.
Interesting.
Yeah.
So what is it to you? Soda, beverage?
Yeah, it's sugar, carbonated water.
Okay.
And
so we're going to remove Josh from this conversation
yes.
because I think he just lost 2 notches from the community. Now, all jokes aside, we know that it's not medicine. We love to say it's medicine because of exactly what you said, Dominique. Yeah. We grew up with this as a remedy in our household for stomach aches. So it's funny when we have this discussion, we're talking about it because, listen, I'm going to subscribe to ginger ale first before I even go to the doctor because of what has happened in my home. Which one of you would like to share your actual patient journey? I'd love to kind of dive in so that we can understand what got you here today. You want to start, Dominique?
Okay, I'll start. So in my teens, I always had stomach problems. Constant going to the bathroom. Didn't know I had mucus in my stool. Of course, at the time, I didn't know what it really was. And in my family, nobody talked about going to the bathroom.
Wait, so did you know that it was mucus then, or you now know it's called
I now know that it's called mucus,
Okay.
but then I just thought it was white stuff.
White stuff?
Yes.
That's a great description.
Yes. That's a great description. I got some brown stuff and then some white
exactly.
stuff.
Some brown stuff and then there's some
like,
white stuff in there. And I'm like, I know I didn't need anything white, but it just keeps happening. Until I was about 21, 22, I started noticing rectal bleeding. blood in my stools. It was constant and it came more frequently. When I went to my doctor, she just kind of brushed it off like, oh, you make sure you're not doing anything back there. And I'm like, no, nobody's doing anything back there. And I'm like, no. So it kept
And was this your
happening.
primary care physician?
Yes, it was my primary care physician. So went back, and finally I was like, this is more than a stomach ache. I had nausea, vomiting, the constant diarrhea. I was losing weight. Finally, she was like, okay, let's get you in to see a GI. When I went to
See a GI. What's a GI?
Gastroenterologist.
Yes.
A doctor that specializes in stomach conditions. So went to the doctor. When I got there, nobody looked like me. I was the only Black patient. I was the youngest. I was the only woman at the time that was actually being treated. How I know this is because my mom was in the waiting room, and I was the last person that they did for the day. And she's like, I watched every man walk out with his wife, telling him it's going to be okay, because most men don't like going. I was diagnosed with ulcerative colitis. They just pretty much told me, like, this is what you have.
So wait, were you diagnosed from that first appointment?
From that first appointment.
Wow.
And I was telling the doctor, I was like, I guess I've kind of felt a relief because I knew what it was.
You had an answer.
But I didn't know how to navigate or what to do after that. They just gave me steroids and sent me home.
Did they give you any information or lead you?
There was like a little pamphlet I remember, and I can't tell you what it said because honestly, it didn't even make sense. It was like another language. So they just gave me that and kind of sent me home on the steroids. When I was done the steroids, they were like, okay, we'll see you once a year. And it really it gave me no direction of what to expect or what to do. So that was kind of how my journey started.
What year was that?
I want to say I was about maybe 23 by this time.
So early 2000s.
Yes, early 2000s.
Okay.
So, that was kind of how my UC journey started. There was no guidance. They didn't tell me what to eat, what not to eat.
Even if your diet had any
exactly,
impact
if my
on it,
diet
right?
even had anything to do with it. I started doing my own stuff and kind of keeping a food journal because I noticed when I ate some things, it would make it worse.
Okay.
So that's when I started my food journal, and that's really kind of how I learned my trigger foods.
Did you have anybody in your family that were actually diagnosed with the disease?
No.
Anybody diagnosed with anything that could be connected to digestion at all?
No.
No. Okay, so this was like a first
This
exploration
was
for
me.
you
I was
and
the
your
first
mom.
first person, nobody else.
Okay.
My mom, she really didn't know all of what I was going through. So I kind of hid it because I didn't know how to talk about it. And I have 4 brothers. I'm the only girl. So imagine in our home trying to bring up poop. Like, my brothers would have been like, what? So
It's so interesting that talking about poop is so taboo, but every single person does it.
Yes.
And you have to do it to survive.
Yes.
So why is it that crazy that we can't even have these discussions comfortably in our home? Because it's like, that's your private business. But the whole world is doing it. I guarantee the whole world is leaving a poop. Like we always say, I need to go take a poop, but they're leaving a poop. We're not taking it. We're leaving it so that we can go do exactly what we need to do to function. So Josh, tell us about you.
So it's interesting, listening to Dom share her story about being diagnosed upon her first visit. Mine was almost polar opposite, and I would say that I'm going to preface the story by saying that it was really broken down, I would say, in 3 stages. With the first stage being a period of time that began with my senior year of high school, just dealing with blood in my stool, a little bit of white stuff, as she called it, and, not really knowing exactly what it was and what it meant.
Well, did you ever take any of the pink stuff to help you with the white stuff?
Pink as in like Pepto-Bismol?
That's the pink stuff,
okay,
right?
just making sure. So, I know it's PG-13, but so I will say that I definitely took Pepto-Bismol.
Yeah.
I probably drank that more than I would drink ginger ale.
Yes.
But,
shout out to Pepto-Bismol for helping when they could. Thank you.
So it was a journey though, because I think Dom also mentioned something earlier, right, about men and how, socially or culturally, we're not really conditioned to really embrace going and getting that kind of help, medical diagnosis, and just even let alone talking about it. So I had those symptoms for at least 6 to 8 months before I actually told my parents.
Wow.
And I was kind of forced to tell them because I was starting, I was actually going to a football recruiting event where college football recruits were going to be there. So I was doing like a combine style thing. So they weighed me and, did all these other things. And when I used the restroom there, I thought maybe it was just because I was nervous and I saw a lot more blood at that moment. So that's when I was like, okay, I have to tell them.
The sharing only came from fear.
Yes, absolutely. Absolutely.
Okay. It's like, all right, I've controlled it for this long. Now it's actually going beyond me.
Yes, absolutely. So that kick-started what I would say would be about a 3 to 3.5 year journey of various tests, blood work, I forgot all the medical terms, but, they had me drink this fluid that went down your esophagus, and they did like these little X-rays to check that area.
Barium.
Yes, barium. I thought that's what it was. I didn't want to butcher it, but that's exactly what it was. And then, the effects of that were interesting as well.
Yes, they were.
Because it was more than just some white stuff. But going through all that, there was a lot of anxiety because I didn't know what it was. I didn't know what it meant. I know you asked Dom if she had any family history, and up to that point, I didn't either.
Right.
So, I'm now fast forward in college. I'm playing, Division I football.
What happened after you went to the doctor? Did you go to the doctor after the combine?
Oh, yeah. Okay. My parents immediately brought me to a pediatrician. So you took the barium, right? And then they set up a bunch of different meetings with, specialists to have me do different tests, which included drinking a barium.
Yes.
I don't think they did a colonoscopy or sigmoidoscopy yet. I didn't have that done until my junior year of college. And that was ultimately when I was diagnosed with a mild case of ulcerative colitis.
Okay, so before that, though, I'm going to back it up.
Yeah.
Before that, you said you drank the barium, you had the series of tests, these things were being done. What was the outcome from the tests and seeing the pediatrician, and what did they tell you from there?
Oh, yeah. So...
and you were about 17 at this time, right?
I might have been 18, but I was 17, 18, I was senior year of high school.
Okay.
And then all the testing started between my senior year and freshman year of college.
Okay.
And initially they diagnosed me with a mild case of lactose intolerance. And then that turned into irritable bowel syndrome.
So lactose intolerance does not cause bleeding, especially the amount that you're saying you saw in the toilet. It just, that doesn't make sense. But okay, so now you're, and usually, so now you've gotten, been determined that you are lactose intolerant and you have IBS. So to define some terms, IBS is irritable bowel syndrome. IBD is inflammatory bowel disease. And a lot of times people use these terminologies interchangeable, but they're not one and the same. IBD has two main diseases that are under that terminology and others, but the two main ones are Crohn's disease and ulcerative colitis. Okay, back to you, Josh. So we've now got these responses to symptoms, not real diagnosis or any real sustainable treatment at this time, right?
Yeah.
Okay, so... play.
So I would say, during that time, they gave me this, prescription medication that basically treated acid reflux. I think it was, it actually became what's known as Nexium.
Okay. Wow.
So I had the genetic version of that, if you will, that they, my
generic
doctor.
or genetic?
Generic.
Okay. I was
generic.
Generic. Okay. So generic Nexium.
Yeah, the generic version. And, I was popping that like Skittles, because...
like the ones in your pocket.
Well, you have to expose me, but yeah.
Okay.
But yes, I mean...
been there.
Yeah.
I used to pop Pepto that way, so I can totally relate to that.
Yeah. And I remember, my then girlfriend in college, she's doing research because she sees me. She's like, "What are you taking all the time?" And so I told her.
Sneaking around.
So she's Googling this medicine, and she's like, "You know that there's some side effects of it?" And I'm like what? And she said something about, it weakens your bones over time from excessive use. And I immediately thought about me injuring or breaking something because I'm playing college football.
Right.
I'm a generous 5'6". I've never seen the top of a
A
refrigerator.
generous 5'6".
And I'm about $160. So I'm by far the smallest by height and weight on my team already.
So you're like, I got to preserve what I have.
Yeah,
because if I lose any bone, I'm going down to 5'2".
Best case scenario, I might play football until I'm 30 if I'm lucky, right? But God willing, I can live a lot longer than that.
Yes.
So I'm thinking like about quality of life as well. And so I immediately stopped taking that, and I was pressing my doctors about finding alternative, treatments than just taking this medicine, because I'm already taking ibuprofen, also because I'm having stomach pains, not realizing that some of that's actually being heightened by the medicine.
Yes.
So that again speaks to some of the lasting effects of being misdiagnosed. And that kind of, I would say, kind of closed out what I would call stage 1 of that experience.
Okay.
Stage 2 began, as I mentioned, where during my junior year, I finally got a colonoscopy. And
So what led you to actually go get a colonoscopy? Because they're not doing a colonoscopy for lactose intolerance and IBS.
I think at the time it was just because my symptoms at that time were becoming more frequent. So
And intolerable.
initially, it was, certain trigger foods and things like that. So it would maybe happen once or twice a year. The symptoms would last maybe for a couple weeks and then they go away.
Okay.
But by this time, my junior year, they're happening more than twice a year. They're staying longer, so it's progressing, right? Or it's becoming more aggressive. And so at this
Yes.
point, they were like, okay, let's see what's going on in there.
They were like, catch me outside. How about now?
Yeah.
Yeah.
And they,
So
they
that
caught
guy-
me with a camera somewhere I never thought it would be. So, yeah, I was not comfortable with that.
Right.
But
So
I
you
am
ended
grateful.
up having the colonoscopy.
Yeah, and they thought that they found a polyp initially, but they did a biopsy, found out it wasn't.
Okay.
It was just like scar tissue or something along those lines.
Right.
And that's when
So
they
what's a
diagnosed
polyp?
me. I really don't remember the official definition.
So based on Josh having a colonoscopy, the colonoscopy is a device. It's a long, tube, I would say.
Yeah.
Long tube, and they actually utilize that tube or use that tube to see inside of your stomach and your colon. It is inserted through the rectum. You are put to sleep. You don't feel anything. They knock you out, not with a fist, but like the medication. And you go through this process so that your colon can actually be reviewed to see if there are things like a polyp. Yeah. So polyps are growths, and they can either be malignant or
benign.
Yes, benign or malignant, which means they can be cancerous or not, benign or malignant. And once they determine that you have polyps, they can also at that time remove them. And once they remove them, they can biopsy them. And when they biopsy them, that's when they actually understand what this polyp is. Like, is it non-cancerous? Was it just a growth? But that is the importance of actually getting a colonoscopy, because you can determine whether there is something more severe that's occurring in the colon. And if you get your colonoscopies frequently at the time you're supposed to, they can determine if you have a diagnosis of colon cancer, colorectal cancer. And that's a disease that's beatable, treatable, and preventable. The preventable side is getting your colonoscopy and allowing those polyps to be removed. The treatable is what follows that, what comes after that. So this is a very important test that is delayed or often not done by our community members, which causes us to have a higher death rate with colon cancer, but more severity in this disease because it wasn't caught at a time where it could have been treatable. Right?
Absolutely. That's a great depiction, and I will go back and memorize this for the next time. But
listen, I'm the Kobe to your Shaq. Okay, I'm just trying to. I'm gonna pass it. You go ahead and dunk it.
Fair enough.
Let's do this thing.
Yeah, we'll make that work for sure.
Right. Okay, so that was stage 2.
Yes.
Right.
Stage
Okay.
2.
They did the colonoscopy.
Yeah.
Then what happened?
And at that point, now being diagnosed with the mild form of ulcerative colitis, I was prescribed a medication that they basically said I would need to take every day for the foreseeable future.
So they did diagnose you after
Yes.
that
Yes.
with digestive disease.
Correct.
Okay. And what did they share? So you just said you'll be taking medicine for the foreseeable future. They gave you pills. What did they tell you to educate?
So they said that it was basically chronic inflammation of my intestinal lining.
Okay.
And that, this is a condition that many in the medical community are still learning about.
Okay.
They handed me a pamphlet and maybe a couple of printed pieces of paper that just spoke to trigger foods.
Okay.
To avoid certain gassy foods, if you will. And then the pamphlet just talked about some resources and things like that. But I think I did what probably any normal functioning human with internet access is going to do. I went and Googled it
right.
when I got home.
They handed you so much more than they handed
definitely.
Dominique.
Yeah.
And both of you had a diagnosis of
Exactly.
UC.
Yeah.
Interesting.
Very different.
But you're in what area, Dominique?
Baltimore.
And you are.
And I was in San Diego.
So East Coast, West Coast. Maybe, the vibes are different on the West Coast.
I mean,
So then after UC, what was the follow-up?
So, again, they prescribed me medication, said they would monitor it, do like blood work to check for inflammation markers and things like that,
Okay.
Periodically. But there was no other course of action except avoid these types of foods and take this medication every day.
And what year was this?
This was 2007.
Okay.
So I'm still in college. Now I'm really trying to process everything, what it means. I'm relieved on one hand because I don't believe this is going to be terminal. And, but at the same time, there's still some unknowns, right? So I was a little bit relieved, but I still had some curiosities that were left unmet.
Right.
And at that point in time, I'm now faced with the difficult decision of having to figure out how I'm going to adjust to kind of this new normal in my life. Being a college student athlete, and trying to have a normal functioning social life, and not even realizing that there's all these other symptoms that I'm still navigating that I haven't been educated on.
Right.
But
that are connected.
Yeah, that are connected.
Yes. And we
So,
call those the extraintestinal manifestations.
Yeah.
So extraintestinal manifestations, or EIMs, are symptoms that we experience outside of our gut, because ulcerative colitis, which we abbreviate as UC, and Crohn's disease are inflammatory diseases, autoimmune as well. They can manifest, the inflammation can manifest in different parts of your body at different times, in your joints, in your face, in your fingers, and how you're processing the food. So like urgency, the list can go on. I mean, and we've experienced a lot of the challenges of that, but those challenges, if we don't know that we're having arthritis due to our body saying there's something inflammation or something inflammatory going on in our bodies, we just think, oh, I did something, I pulled something, I sprained something, but it's really the body saying, you're not under control right now. The disease is diseasing.
Yes.
Right? The disease is diseasing. And we experience that, but we're not educated that it goes outside of where we think it's supposed to reside. It is not, in the belly is where it's supposed to reside. It says, no, in the body is where I reside.
Yes.
Right?
Yes.
Every
The
part
entire
of it.
body.
And so people that aren't educated, like ourselves who are actually patients, if we're not educated, how many more people are? And they will say, oh, this person is being lazy, or they're just being unresponsive or disregarding, when there's also that layer of extreme exhaustion and fatigue, which is an EIM, from this disease that people really don't understand, or they're not aware of, and they're thinking that this is what we're being, this is how we're responding, when it's just how the body is being, and we're trying to just live.
Yeah. Well put. The excessive fatigue was a huge thing. It actually impacted, when I would be in film study and watching things, and I'm exhausted because we're doing this right after lunch, and it would be like clockwork. My body's trying to process or digest that. I want to go and take a nap, like a 5-hour nap, not a quick one. And so I fast forward and say all that to say, because of the different challenges, I ended up making a difficult decision to stop playing football my senior year to focus on adjusting to this.
See, and that's the story that we don't often hear, and all three of us can actually relate to that. We had to stop something that we were passionate about or committed to or wanted or desired or aspired to, because the disease says, I'm the boss of you. And that's the long and the short. I'm the boss of you. And people don't recognize, like, I know that I experienced a stage where I just disappeared because every single aspect of me I needed, and it wasn't much of me left. It was like I went from 100 to like 25% of myself. Can you relate to
And
that,
that's the
Dominique,
thing, like
especially
this,
as a mom?
this disease, like it doesn't care. So the
It
year
does not.
the year my daughter was born, and I can tell you, my daughter was probably about 2.5 months. I lost my vision, and it is a result of uveitis, which is an offspring of
It's a
ulcerative
EIN.
colitis.
Yeah.
When I woke up that morning, and I can remember it just like it was yesterday, because it's something you just never forget. I woke up and my eyes were just like a little fuzzy, and I was like, oh, what is this? And I was like, maybe I need to lay back down. But you have a newborn baby, so there is no lay back down.
Right.
So it's like, okay, you keep going. But as the day went on, I could see less and less, and it was scary. Not only did I have to take care of myself, but I had a newborn baby to take care of. I get to the doctor and they're like, oh, you have HLA-B27, which is a whole nother offspring that we,
Yes.
I definitely know. I have never seen another person of color with that same diagnosis, which is another autoimmune condition, which is an offspring again of ulcerative colitis.
But maybe people don't know.
And they don't, because honestly, I still don't completely understand what it is.
Right.
I can't say that, I was properly educated on what it was. I went to 2 different ophthalmologists. One finally at Hopkins, really, really great doctor. He got my vision back. It was a battle because the drops that he recommended, the insurance company didn't want to pay for, and I had good insurance.
Whatever good means.
Yes, whatever good means. But they didn't want to pay for it, so they actually made me go on one drop, which was like a steroid drop, for a few days before they give me the one that he recommended. And when he gave me the one that he recommended, my vision, when I tell you, within one day, I could probably see fully again, as opposed to days on a medication that did nothing. It was just like I was putting it in, and honestly, it was burning my eyes more than it was doing anything else.
Yes.
So if I could tell you, UC definitely stopped a lot. It changes how we do things, even the train ride here, just to be honest. Like, I mapped out every bathroom. When the train is late, it definitely, it sends a trigger for us. Things that I didn't even realize, trigger us, because we really have to map out, because we don't know when our bodies are going to say, okay, change your plans. So we try to control what we can control.
Restroom anxiety and toilet anxiety, that's another great space. Those are real life anxieties.
Yes.
And they impact even us wanting to be social. I don't want to be there. Or let me tell you something. I used to have a shoe company with my mom. We used to manufacture these shoes. And I was really, really sick, but still trying to show up because we don't want to be discounted out of these experiences. Oh gosh, bless my mom's heart, because she means well. But she was literally coming into the bathroom. I'm in the conference. There's 18 stalls in this bathroom. I'm sitting there trying to mind my own life. And she comes in. Melody, it's mommy. It's mommy. Are you okay in there? And I was like, yes, mama's okay. I can't hear you, Melody. Which one are you in? Are you okay?
That's terrible.
Moms don't care.
It's
They're going to find you.
It's terrible, but even now I can respect it and I understand. But I was so embarrassed because I don't think I was diagnosed at that time. So I was struggling with that space of what is going on with me. She knows I have to sit in this bathroom. Why didn't she just text me? Why is she doing this? And now it's kind of just par for the course, though. If I'm traveling or I'm not feeling well and I'm with my friends or my family, they'll come in the bathroom. Melody, I'm like, yeah, I'm here. Stall number 3. Just, waving my hand under this device. I'd rather them check and know that I'm okay, because it's from the love.
Yeah.
Not, although
Yes.
it's embarrassing, but it's for them loving and wanting to care, and they don't know what's going on. And I'm always grateful that when there is a bathroom, that I could actually go in and sit in there and not feel like, oh my gosh, there's a snake that's going to come out. Because I always feel like there's a snake in the toilet. I don't know why. It's never happened to me. I've never experienced that. I got to stop looking at social media because other people have, and I just always feel like that. And I think it's just a space where we're having to navigate so much, but that's a really big component of these challenges.
I think one of the other things is, how do you really explain to people what you're feeling, because they don't understand.
Well, we can't explain it a lot because we don't understand.
Exactly. So sometimes I know my mom, she has a lot of questions. And sometimes I really have to tell her, like, I can't give you an answer for that right now. Like, I'm at capacity. Like,
Yes.
I tell my daughter, like, you've exceeded your questions for today. Like, that's it. Like,
That's
no more.
also a very real space to understand where your capacities are now that we're navigating, like the ins, the outs, the ups, the downs, the drop-in loads, like all of that.
Yes.
You know, we have to understand. I don't think people can have a real gauge of this disease because we don't. I've gone from times where I'm not using the bathroom for over 21 days and now hospitalized, to using the bathroom 36 times a day for a month. 36 times. How do you work? How do you take care of your family? How do you show up? How are you functional when you're literally going into the bathroom because it feels like you are going to use the bathroom on yourself?
Yeah.
And when you get there, it's a drop of blood or it's just a drop of stool, but you have to run to the bathroom because you don't know what's going on because it's mucus is coming out. Even like that many times, it's mucus or it's so much to like take in. So people want to understand. It's like, we don't understand. We're trying to take it in. We're trying to get it. But again, talking about this seems so taboo in normal settings. And if you don't have a community, which is what brings me to my next question, how do you even discuss this without feeling like I'm the anomaly or I'm the one that always needs the attention? Because I don't even want attention. I don't need attention, but I'm sharing this because this is really what's going on. Like, you can't say, how are you feeling and what's going on? And then I give you all this information. You're like, wow, don't complain. I'm not complaining. I'm just telling you, I just use the bathroom 36 times a day. I can't eat anything. No, I can't go with you because I need to have a toilet attached to my bleep, and that's just it for the day.
Yeah.
And then, like, how do you do that?
Yeah, I don't know that it's possible to really do it in a long-term sustainable way without having a community because, you know, so much of our disease, and I think we've kind of talked about it indirectly, is treated in a way where it's invisible.
Yes.
So right? And so because it's invisible and we don't always look sick.
Yes.
It's how do you know?
That is so key. We don't look sick, but what does sickness look like? Because all three of us are managing a disease.
Yeah.
So
It looks like us.
Yeah.
yes, and one of my friends, she said to me the other day, and she doesn't realize that she said it, but she was like, this is why nobody believes you're sick, because you just get up and you still do everything. And I'm like, yeah, because who else is going to do it? Like, I don't have the option to not do it.
Yeah.
I had a friend tell me one time, Mel, I know you're sick. I live with you. I know you. I know you're sick, but you just make it look so glamorous. And I was like, what? How, like, should I come in this space of being extremely downtrodden? And that wouldn't be real because I'm not trying to be a victim of the disease.
Exactly.
I'm not trying to be the person that's saying, what can I use to manipulate people? I want to show up. I want to be well. I want to channel those energies. So I'm not going to stop or subscribe to sickness looking like this to make someone else feel validated about my sickness.
Yeah. And that's part of the reason why having that community is so important, though, right? Because even when we have our immediate family or friends who are caring, who want to understand, who want to support us, right? We're usually in some early stage or infancy in an analogous way of learning about not just the condition, but how it's affecting us and how we can navigate our life through that. So having to experience it and then learn and then also narrate it to others can be exhausting. And so having a community where people understand on a foundational or fundamental level because they either have it or they have close proximity is just a relief because then you can exist
Yes.
And you can talk about things on a very, very simple level, and
Yes.
more times than not, they're going to get it. So
Yes.
you have that relief.
And sometimes you don't even have to talk. Like, I walked in the room the other day and I was like, go lay down. And I didn't have to say anything. I didn't
see it.
She could see it. So sometimes, honestly, just being in that space definitely
Yes.
is comforting.
Go lay down, girl. Go lay down. But I could see it. And we see each other, I think, so differently. And we show up for each other so differently because it's just the communication of space and not really verbiage. It's like you can walk in. Oh, you already know.
I know. We gotta go.
You know, I'm gonna be like, this has happened in your life, this, and this. Why didn't you tell me? Why is it? You're like, how do you get all of that? How did you see? I'm like, I already know.
Yeah.
Both of you were diagnosed pre-coaching, so it wasn't. I mean, I
Yes.
guess we all were since I started coaching, but both of you were diagnosed pre-coaching. How has life been pre and now post? Like when you're talking about community, and where have you really noticed a difference, and has it added any kind of value?
Definitely. COGI is like family. I call them my real family and then my COGI family. So it gives us a space where we can just be, where we can talk about poop or we can talk about anything. Honestly, because we can talk about poop, there are no limits.
Right.
We can be comfortable, we can cry, we can laugh, we can not feel good, we can feel great. But we try to make each other mostly feel comfortable.
Yes.
Yeah.
I'll speak on it from a representation standpoint. I think knowing the intent of this nonprofit, not just trying to raise awareness and advocate for Black and brown IBD patients, but also just from a representation even in the medical community with healthcare professionals, with companies that are creating drugs.
Yes.
When we talk about clinical trials and things like that, like I've had this condition or at least symptoms for almost 20 years now.
Yes.
And I've never been asked to participate in a clinical trial. And so when you think about how, historically, there are a lot of disparities in treatment,
Yes.
and there's underlying racial biases.
Yes.
How do we treat, as we talk about our condition, right?
Right.
The source of it, and not
Yes.
just manage the symptoms when
The structure.
if you can't systematically embed our representation at every level of care.
Yes.
So for me, I
Say
think
that again. You were the offering, please.
I think that, to repeat some of it or paraphrase it, because I didn't rehearse this, it's one of those scenarios where I think that if we're looking to treat this equitably
Yes.
and
Yes.
holistically,
Yes.
we have to be ingrained from a representation standpoint at every level
Yes.
of
Facts.
care and support
Yes.
in the medical structure.
Yes.
And so when I think about COGI, it definitely represents all the things that Dom said, but what it's also done is actually empowered me to use my ability to speak, because I think
part.
that's one of my God-given abilities, is just to
Yes.
speak. But I want to use it in a way that's bigger than just me, bigger than just what I'm experiencing. And I also want to do it in a way that, as a Black man, a Black American, and just as a man, because we, again, aren't as proactive about going and getting treatments. We don't even talk to each other about this
Right.
kind of stuff.
We
and
just
we pride
talked about
ourselves.
that.
We
Yes.
pride ourselves on our pain tolerance.
Yes.
How backwards is that?
Yes.
So thinking
Yes.
about those things, right? We're in a space now where I think socially we talk about mental health and
Yes.
balancing things.
Yes.
But mental health is tied to your physical health. It's
Yes.
tied to your emotional. It's tied to
Yes.
your spiritual. So I just think it's important that as we navigate these things, we try to do what I call humanize the experience.
Yes.
And that requires transparency, which, as you all mentioned, it's very difficult to find that balance because of the sensitivity of the topic, because of the intimacy of the details of what we're experiencing, and sometimes just the literal physical or
Yes.
emotional fatigue of
Yes.
how we're feeling navigating it.
What I think is really great, Josh, is you're really sharing with me how you found your voice in this space in particular. Like you're a great public speaker. I've heard you. I've seen you. I've put you on stages because I know. But what I think is awesome is that I could hear you saying, because I was connected to COGI, I actually took a deeper dive and understood the inequities that are presented to this community, not just from a space of, oh, this is wrong, I wasn't treated like this, but No, this is systemic. This is not just one size fits all. It's not one response. So it's going to fold me into what I'm going to ask you next. How do you feel about being a patient advocate? Because you are a patient advocate.
I would say that right now I'm encouraged because of the perspective of, where we're at from just an information and awareness capacity compared to when I was initially diagnosed in 2007. I would say the information that was available or accessible and the resources was very much in the infancy stage. And I would say now we're probably right before we're getting to like those teenage years, in terms of that.
We move fast, right? And we're only 3 years old.
Yes. So I think, COGI has equipped me with not just the resources or the knowledge, but the opportunity to be in spaces with like-minded people,
For sure.
Not just patients, but healthcare professionals, pharmaceutical
An
reps.
ecosystem.
Yeah.
Yeah. Dominique, how about you? How do you feel about being a patient advocate?
I love it. COGI has definitely empowered me. If you would have asked me before COGI if I was gonna speak at Capitol Hill, I would have told you were absolutely, or on a podcast. I would have told you were lying. I might be back there holding the camera, but I would not be. So definitely,
that is so true.
Definitely, I am a behind the scenes. Like you want me to do something back there, I can do it, but on camera, definitely. Mel has definitely empowered us all, especially me. I can only speak for myself, but definitely using my voice, realizing that so many people are going through this, and if we just continue to be silent, how do we help the next generation? And I think that's the thing that when we were on Cap Hill, I was saying, like, we are changing generations. We are making it better for the people who come behind us, because honestly, right now, it's not really about us. It's about helping generations so that no one has to go through the same things that we went through.
So you were on Capitol Hill recently.
Yes.
So what were you doing there?
Tuesday,
Tell me, why would you go to Capitol Hill?
This past Tuesday, we were talking to Congress about changing some laws, step therapy. We talked about the Co-Pays Act. We talked about the Medical Nutrition Act. We talked about Allie's Law. Am I missing anything? I think
we talked about them actually joining.
Yes, joining the Crohn's and Colitis Caucus. Yes.
And I want to reiterate, because I shared this with you before, you did a phenomenal job.
Thank you.
The team, the ambassadors, they were just amazing. And I feel like the more you are using your voices, the more you feel confident in sharing your journeys. I think that's probably why you're here today, to be able to do this, because you've been doing the work to say, if I don't say anything about changing what's going on, it's never going to happen. That's how valuable you are, though. Now, we have all of us have spoken at different events, and we've engaged with all kinds of communities and different leadership, but also different patients. And I want to understand if you all feel like with COGI, I think that we create programming that speaks to culture. It speaks to us, meets us where we are, but it's not making us or our community members have to go and look or go reach beyond what feels comfortable to them. Do you think that's valuable?
Definitely. I feel like COGI gives us a complete picture. So you can join other organizations, but it doesn't, for me, it wouldn't fit completely who I am. Because if your research and your data doesn't include me, then how can you help me?
Right.
Yeah, I think it's because, this being an autoimmune and a chronic illness, that we navigate every single day. It's a part of our life.
Yes.
It affects us how we show up to work, or our ability to show up to work. It affects all of our key relationships. And so when I think about those things and think about what COGI provides and the space that they've created, it's very much a space of bring your authentic self.
Yes.
And I think that because that message is there, and that's probably the first thing that you're going to get when you meet you, and then, the rest of us.
Listen,
I think
I'm going to be who I'm going to be.
Yes.
Yeah, it starts from the top. I think that's always,
Yes.
any organization is going to adopt the personality of its leadership. So for me, I mean, you already know how we vibe and how we rock. So it was like, when I saw you do it, I was like, word? I was like, okay, we switching. Okay, I could do that. Like, I'm like, we're going to navigate this. We're going to be solid. So I think, I just think about this space, and I think that it's necessary.
Right.
And I'm grateful for it. I'm grateful for its growth. I'm excited about its growth. I'm humbled by the speed in which everything has progressed and the
I'm
visibility.
glad you're humbled because I'm exhausted. But I'm going to take humble.
I mean, I am only because I say humble because a lot of times we can be in ourselves and we can think about where we're at. And I just gained so much strength listening to Dom and listening to others share their stories, do the advocacy work. And it's a nice piece because, being in the background of playing sports, you learn that you can't accomplish everything in a team dynamic by yourself. Everybody has to pull their part. And it's much better to get 100 people giving 10% than one person giving 100%. So I think it's just the fact that we can share that responsibility and hold each other up in those moments where we need that extra push. It goes a long way, and it's truly invaluable.
Yes, I think it's important to just acknowledge that you shouldn't have to sell yourself out to get an opportunity. And I feel like that's what some of these opportunities are set up to do. Well, if you conform and you look like this and you meet these criteria, even in research, like these exclusion criteria, and because it's not really inclusion, it's saying, here's how I can disqualify you. That's not what we should be doing, especially in health. We should be able to really go back and say, you belong here, you're included here, we thought about this for you. It may not check 100%, but it should at least check 75, 80%. And that's a win. And I believe that's what we're striving to do at COGI, is to for the greatest good, so that we reach and change these outcomes. We've come to the place down the show where you have to drop that deuce. And what that means is you get to share the 2 takeaways you want the audience to leave with. I'm going to start with you, Josh.
Okay, 2 takeaways. I would say the first one is giving yourself grace. Whether you are somebody that is newly diagnosed, whether it is progressed, whether you are now in remission, I want you to know that because this is a evolving disease that looks so different for everyone, it's very easy to compare where you're at to others, even others with similar conditions and similar symptoms. So give yourself the grace to be whatever condition, state that you're in, and embrace all of those emotions that come with it. If you're scared, it's okay to be scared. But I would also say the second piece that I want to attach to that is find the strength to be transparent. Find the strength to have a voice, because you will only receive the kind of care that you're willing to advocate for.
Yes. Thank you.
I can't limit to 2. Okay. First,
then you dropping deuces.
Listen, I'm dropping deuces. Okay. First one is definitely listen to your body. A lot of times we push ourselves, but sometimes we have to learn our limits, which is a big thing. And if you have a chronic illness, definitely listen to your body and then make your doctor listen. The second thing is, of course, join our COGI fam. We would love, shameless plug. And the third thing is definitely love on yourself more.
Facts.
Yes.
That's a great one. Yeah. 3. I'll take
it.
I think that's
3.
great.
3.
Definitely.
That's what I'll stop it.
This has been an amazing episode on Now Labeled Patient. We hope to see you again. Until then, thank you for tuning in.
Running through it with the young influence, adolescent presence, also coming to it. I've been giving yeses when I shouldn't do it. I complete ejected, but the moves elusive and I'm barely moving, but I'm still gon' boost them. I can't work on winnings when I know you're losing, so I work the winnings and they throw the deuces. Guess I had to pivot, shooting the bazookas for the